So my role at Country SA PHN is manage state partnerships. I work with the LHN and also peak bodies looking at our health issues with a statewide approach. I'm fortunate enough to have Tracy as part of my team and also some project staff. So I wanted to talk to you today about a cardiac program that we deliver through Country SA. So in these next 10 minutes, it's my goal to take you to a place where your heart is not working so well, unfortunately. You've experienced a heart attack, you're now through the danger period, treatment in hospital has occurred and you're ready for discharge home. What next? Can your life be the same as it was before your heart attack? Will you have more heart attacks? Thoughts of this is the end are normal. Treatment for a heart condition shouldn't end in hospital. Supported recovery can continue when you go home. But how does this work when you're living in a rural or remote region? How will this support be provided? So the Country SA PHN is the primary health network for Country South Australia. As Tracy already mentioned, primary health networks across Australia. Hopefully you have met with your primary health network in your region. We do have two in South Australia, one for Metro and one for Country. And our borders align with the Country Health SA local health network. And our mission there, bridge the gap of health inequity and access in rural South Australia by building a collaborative and responsive healthcare system. So our region, we are the purple area, so we cover 99.8% of the state's geography, but only about 30% of the population. We work closely with our metropolitan partners, Adelaide PHN, and one example of that was Tracy's Immunisation Hub project. So our objectives around efficiency, effectiveness and coordination of care. So research shows that if a cardiac patient accesses a rehabilitation health professional soon after experiencing a cardiac event, they have a much better chance of reducing their risk of having a further cardiac event or even dying. For many rural and remote people, access to health professionals can be a struggle for routine care. Access to cardiac services is even more difficult. So in response to this, Country SA PHN, with our objectives of effectiveness and efficiency, has funded the Country Access to Cardiac Health, which is known as CATCH, program across Country SA. The CATCH program enables those living in Country South Australia who have a cardiac event to access the same level of follow-up support as those living in metropolitan areas. So the CATCH program is delivered by the Integrated Cardiovascular Clinical Care Network, otherwise known as ICCNet. They've been delivering that program for 5 years. Initially, it was contracted by Medicare Local in the Country South region, and then when the PHN started, was offered continuity of service. So the original region was just the southeast Riverland and Mallee Coorong parts of South Australia. So guided by our 2015 needs assessment, we could see the benefits in the program for all of Country South Australia and expanded in 2016-17 to go Country SA PHN region-wide. Just useful to note that prior to the statewide rollout of Country SA rollout wide, the wait for face-to-face access to cardiac rehab was around 6 months for most areas of South Australia. So the objective of the CATCH program, it's been designed to provide country residents access to cardiac rehabilitation services by both telephone and telehealth. So again, just that same level of support as people in metropolitan areas have. So the delivery model is that patients are referred to the CATCH program upon discharge from hospital following a cardiac event. The CATCH program is conducted over a 2-month period, and each patient has approximately 7 coaching sessions as well as follow-up at 6 and 12 months. The patient receives tailored health advice from both specialist nurses and allied health professionals, and this advice ranges from heart health education, nutrition, pharmacology, exercise, lifestyle changes via the weekly phone or telehealth consultations. So all Country SA patients upon discharge after certain cardiac-related admissions are referred to the CATCH program. Patients are phoned and offered the opportunity to either participate in the CATCH remote support program or their closest face-to-face group class there are a number of criteria for entry if people are interested. So we have had some successes with the program. So the picture there is we won the local LHN, so the SA Health Awards 2017 Dr. Peter Chapman Award for Excellence in Country Health to ICCNet. So the topic was overcoming health service barriers with technology. So we're very excited to receive that award. So the primary healthcare nurse role within CATCH. So the nurse works with the patient to develop a care plan, identifies with the patient 5 relevant allied health services which are delivered as part of the care plan. They complete the initial nursing assessment, and then that nursing assessment and care plan are uploaded to the CATCH program tab, which is a web-based tool. And the primary healthcare nurse also conducts a 12-month review of patient. So there's also capacity building of the primary healthcare nurse in the local community. They learn more about cardiovascular conditions and can be ongoing local resource for beyond the cardiac rehab program. So primary healthcare nurse involvement in cardiovascular health is further supported by other links that PHN has with the Heart Foundation, and I actually have a poster detailing some of that work here at the conference. So the performance of the program, the telephone support program, in the last report, which was earlier this year, there'd been 4,836 occasions of service delivered between the 1st of July and 31st of December. So that includes assessment, the allied health services, nursing services, and also some administrative services as well. And that was to a total of 633 formal clients. So there's a GP hybrid program as well, which uses the nurse, primary healthcare nurse, and that program's fairly recent addition, and so far about 30 patients have gone through that program, and it's running in 7 general practices in South Australia. So the successes, we have a high commencement rate of both programs and also really high completion rates, which is great. Just recently, the clinical nurse of the program sent me a good news story about a video consultation consult she had in conjunction with the practice nurse, the patient, and the patient's wife. The patient was quite reluctant to engage with the telephone program despite the obvious need for cardiac rehab. So the practice nurse did a GPMP and a TCA and ensured that the patient was connected with a dietitian, physio and podiatry. That's what the patient wanted to have. And then also connected to a pharmacist for a home medicines review. The patient said to the nurse consultant from the CATCH program at the end of the consult, "In the beginning, I didn't know why you wanted to keep calling us all the time. Now, after our conversation today, I understand. You have answered all my questions and it was so worthwhile. You're right up there in my books." So the nurse was very pleased with that comment. So just got a couple of case studies. These visuals are just for effect. They're not the people of the case study. So case study A, this is a 55-year-old male. He was admitted in March 2011 to a tertiary hospital in Adelaide for acute coronary syndrome with a resulting treatment of 5 coronary artery bypass grafts. He had a past medical history of type 2 diabetes, which was insulin controlled, hypertension, meningitis, hypercholesterolemia, and was an alcohol binge drinker. Following the bypass surgery, he was discharged home 1,000 kilometres from that metropolitan hospital, and he didn't have any cardiac rehab at that time. It was important to note that in 2011, the CATCH program was not available in that region of South Australia. So 5 years later, the gentleman presented for cardiac screening within his local community, and fortuitously this coincided with the CATCH program outreach visit. That wasn't meant to skip, I'll just move it back. At that time, his health was not good, and he had non-fasting bloods of HbA1c of 13.2, his glucose was 17.3, and his cholesterol was 4.4. So there was a discussion between the cardiologist and the CATCH program staff, and the patient was quite receptive to commencing a cardiac rehab program. So he started that in early September 2016, and was also referred to a local GP at that time who increased his diabetic medication. So he came back a couple of months, less than a month later, and already then had made significant progress. So his HbA1c was down to 11.7, his glucose was now 5.9, and his cholesterol was 3.48. So a huge improvement in just a month. Unfortunately, this particular patient was involved in an MVA in late 2017 and passed away. He was a rock in the community, a huge advocate of the CATCH program and well liked by all, so very keen to still share his story and hopefully encourage more people to be involved. Just a second case, a 64-year-old male. At his 6-month review, he had lost 30 kilos since starting the program. He went from a 4 extra large to an extra large. He commenced exercising for 1 hour every night on his exercise bike, and his cholesterol was great. He felt positive, fantastic. His whole life is ahead of him. So fantastic stories that have come through the program, not isolated by any means. There's examples of where the CATCH program pharmacist has identified life-threatening reactions to medications which hadn't been picked up by specialists, and were able to rectify that problem. So fantastic program. So for the patients whose stories I have shared and many more, the CATCH program has helped them on their journey to recovery. The CATCH program opens the door for people who have returned to work, for those who don't drive, or for those who don't have a cardiac rehab program in their hometown, or even for those who just want to go on a holiday. CATCH has had participants who have travelled across Australia on their holiday while participating in the program, even receiving calls while located here in Brisbane. A program such as CATCH, while simple in design, is delivering big outcomes. Such a program design is not exclusive to cardiac rehab and could be well utilised for other areas such as pulmonary rehab, diabetes, or other chronic conditions. Through a GP hybrid model, there is an opportunity for primary healthcare nurses to be more involved as part of a multidisciplinary team, working together to support the patient with managing their chronic conditions. So as I now close my presentation, thank you for listening to a snapshot of how we at Country SA PHN are catching the hearts of Country South Australia through the CATCH program. Enjoy the rest of the conference and this lovely location. Thank you.